What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for October 15, 2020. A pediatrician's take on the indirect impacts of COVID-19 on children's health. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Megan Schutte, a pediatrician at Johns Hopkins, about the seismic shift in how she and her colleagues are treating children during the pandemic. They also discuss concerns about kids' mental and physical well-being as the world has shut down around them. Let's listen.
Dr. Schutte, thank you so much for being with me today.
Thank you for having me.
So tell me a little bit about your job and the people you work with.
So I am the medical director at a clinic at Johns Hopkins Hospital that's called the Harriet Lane Clinic. We are a clinic that serves 8,500 children and adolescents in Baltimore from some of the most vulnerable neighborhoods. So most of the children that we see are on public insurance. So they really are some of the kids who are vulnerable because of the economic state that their families are in.
And
that's the main population. Go ahead.
I was going to ask you sort of how COVID has impacted them directly, but a little more about how you're concerned it's impacting them indirectly.
So I think COVID is just a seismic shift for everyone. It's the seismic shift in the world, the way the world functions, and particularly for kids. You know, no matter where you come from, no matter what your background, for every child and adolescent, it's a profound disruption in their lives and really the whole social fabric of their lives. And luckily, you know, kids have not had the illness and death rates that adults have had from COVID. And so I think a lot of people don't think about all of the other consequences that are really on them, that are the short term and the long term in this disruption that's so profound in their lives. And just the wondering and anxiety about what will happen next really affects all of them now and will affect them in the future.
Are you seeing mental health impacts in the short term?
So we're definitely seeing mental health impacts in the short term. There's a lot of anxiety and increased rates of depression. And these are all totally understandable with, the fear of the unknown that so many people are going through now. With stopping school and schools shutting down, that for so many children is really one of the most stable things in their lives and one of the things that they can count on for routine and also trusted adults who they can talk to about many things. So the stopping of schools for so many has been just also an increasing point of anxiety and depression for so many kids. There's also fear of illness, fear of illness for themselves, fear of illness for loved ones. Some of them may have loved ones who are being hospitalized or may die from COVID. And that's also very hard. And then also just everything that's surrounding in the news, with all the discussions of COVID can be so concerning. And I think there's also a sense of grief and loss for so many families, even if it's not a loss of a life per se, it's a loss of the lives they used to live. So, graduations that were going to happen, sporting events, science fairs, dance shows, all the things that are part of being a child and being a young adult, all of those are disrupted. And that really does have a profound effect on children's lives now, but also, on their futures.
Are you finding that people are still bringing their children to the clinic, or are they afraid to bring their children in this time when we're told to stay home?
I think, as in everything that we talked about, this seismic shift, there's also a seismic shift in medicine and in pediatrics. There is, once our busy halls that had kids running around and laughing and playing, they really replaced a lot of now with televisits and computers and a very different way of practicing medicine. And we have seen a dramatic decrease in the number of patients we've seen for many reasons. There's an interesting Commonwealth Fund report that just came out recently that documented this in outpatient practices nationally. They reported that between mid-March and mid-April, that outpatient visits fell by 60%. And this was particularly in pediatrics, where the school-age visits, so 17 to 17-year-olds, fell by 70%. and 0 to 7-year-old visits fell by 59%. So huge decreases in terms of the number of visits. And there was some, huge increase that's happened in telemedicine, but in proportion, this increase is still very small. And there's a huge number of visits that, children are not having. And some of these are structural reasons. There has been a change, and there was a shutdown of some of the health system for a while, which is opening back up now again. There's also structural reasons like access. So transportation, getting somewhere, caring for other children who might be in the home if you're bringing a child to an appointment. Lapses of insurance enrollment, such as Medicaid, where you may not be able to now go re-enroll now because of things that have happened with the shutdown. I think there's also, even if offices are open places, there could be confusion among family members and is the office really open? What type of visits are they having? So I think those are a lot of structural barriers. There's also, like we talked about, the fear and anxiety, which again is totally understandable in this time when people are told to stay home. And that's really one of the things that is helping us as a whole, because people are staying home. I think a lot of that keeps people away from offices and concerns about safety. I've also heard from a lot of patients them not wanting to overburden the system. So thinking that every doctor 24 hours a day is working on the COVID crisis, and that by them coming in for what they think may not be, as important of an immunization visit, that they're somehow adding a burden to the system that is already taxed. And so that, I think, is also something that is a misconception, that so much of the health system is working on COVID, and there's still a huge amount of the health system that we think, is really important and vital for preventive care and all of the things we do as pediatrics now that will prevent disease now and in the future. So there's also that whole kind of aspect. And there's the perception of risk, I think, versus the reality of risk, which right now is really hard to tease out. Even for me as a medical professional, hard to tease out yet for most people to think through.
You mentioned immunizations, and that's something that I'm particularly interested in. I imagine there are a lot of people who are not coming for their routine immunizations, and that could be a concern.
I think for pediatricians across the country, this is a huge concern. And I also think it's becoming more of a concern that the general public's becoming aware of. There's been more media around this, also about decreased vaccination rates. For most diseases to have herd immunity, you want about a 90 to 95% vaccination rate, which is pretty high. In some recent years, the U.S. has had some declining vaccination rates, enough that, it's been national news about measles outbreaks across the country. Recently, within the past year, we've had a measles outbreak in Maryland here where we are. And so that's always been a concern for us. And so that really becomes a concern when you're thinking about dropping immunization rates. So no one knows for sure right now, because we don't have the data yet, the decrease in immunization rates, over the last month as we've had the shutdown. Estimates right now are from anywhere from 20 to 50% decrease in immunization. And although this may be a decrease for just a small number of kids, this decrease really does magnify itself when you think about if you need such high herd immunity rates for different diseases. So that is a big concern for us, particularly things like pertussis. This is whooping cough that really affects children, for newborns and children within their first year of life. And, I've seen in my own career many children be hospitalized with serious pertussis, and I've seen children die from whooping cough. And so that's a risk that, is very pertinent to children. Then there's also measles, like I said, for the measles. And one thing, we talked about, which I can pause and talk about a bit for, is, there's this thing called R-naught that we've all been, I think the lay press has become a lot more familiar with. So R-naught is the number of cases on average that an infected person will cause during their infection period. So the higher the R-naught, the more infectious something is. So I think it's important to think about that as we think about all these diseases too. So measles has an R-naught of 12 to 18. So for every person that's infected, 12 to 18 people, they will infect 12 to 18 people during their infectious period. Now, the regular seasonal flu has an R-naught of about 0.9 to 2.1. And then the SARS-CoV, which is COVID-19, which causes COVID-19, that is 1.5 to 3.5. So if you think about that, measles was 12 to 18 and SARS is 1.5 to 3.5. Measles is one of those things that we're really, really concerned about outbreaks, and also then the severe effects that can have on children.
So you were talking about how immunization rates are down and visits to pediatricians are down. This could really cause long-term damage to these practices. I understand that some are concerned about whether they'll be able to reopen again.
Yeah, I think this is a big concern for individual and public health going forward. As talked about, this is no one knows what the practice of medicine is going to look like tomorrow, yet in 6 months. Will patients return in the way that they did? Will people want to interact with the health system in the way that they did? I think these are all huge questions that we're all wondering about in the future. And in the meantime, many practices are struggling because they don't have large margins with which to pay their own staff, and and they are dependent on the number of visits that they have. And so when there's these kind of dramatic decreases, there really is a huge financial pressure on practices. And one of my concerns is that many community practices will not survive through this pandemic, and that they will close, and that many children will not have access to the care that they need after this. So that's definitely a big concern here.
There's something that also concerns you, and that's about a recent story we saw that said that child abuse cases in Maryland were down. But I think we're concerned that perhaps there's just not enough people reporting them.
Yeah, that's definitely a concern for us, that there may be actually increase of child abuse, but children are not presenting to the people who would be trusted adults who could help with this. So schools, kids are not going to, and then also they're not coming to pediatricians and other places that might be mandatory reporters for child abuse. There was also an interesting story from DC Children's that they reported that also their hospitalizations for child abuse were down. However, the children who were hospitalized had much higher rates of severe trauma. So they were they were not getting the lower level child abuse, but really those who were the most injured, which is another really concerning thing.
What can we do right now, for our own children and for children who need us, who need you guys more than ever?
So I think the first thing is, if your child is scheduled for a well visit or some interaction with their pediatrician, call the office, see what they're doing, figure out what's going on there. Do they offer virtual visits? Can you do that? Do they still want you to come in person for a vaccine visit? What procedure are they doing to clean their office? Find out all the information that will help with fear and anxiety that families may have going to the pediatrician or going, to a doctor's office in general. Then also just talking to kids, talking openly about them and with them about what's going on in the world. And then also, when you sense that they are having anxiety, reaching out to pediatricians and health professionals. That's what we are here for, what we're trained in, what we can help refer to other health professionals as needed. And we're still up and running. We're still here doing all the things that we want to do to keep kids healthy. There are some opportunities that are also growing out of this. There's really an opportunity to think about how we can change the health system to make it more family-centered and reinvent it in so many ways. And, I'm actually been a telemedicine doctor all day today. That's what I've been doing. So I just took some time off for this. And there is something that is amazing about the opportunity to see a family and child in their home through a telemedicine visit. Early in my career, I did home visits. And there's something of this similar feeling of how people feel somehow more comfortable in their home or in front of the screen. And the things that you talk about just feel different and sometimes more real. And there can be able to really meet people on their own turf versus kind of the hospital turf. And that's been really, I think, an amazing opportunity to think about. And so I think for people who are hesitant maybe about telemedicine and televisits and how that would work, I would say give it a try. Try and do it with your office, see how it feels to you. Know that it's new for the whole medical profession as a whole, and we're all learning together, and that there really can be something magical about it and a really amazing connection that can be had. It's also really been an amazing opportunity for me to be able to talk with other caregivers in the home I may never have talked to. Like maybe there's an older sibling who cares for a child most of the time. Maybe there's another adult who doesn't come to visits, and I can give the same message to everyone in the house and get information from all them, which is also totally amazing. I think also now really an opportunity is to think about is recognizing the importance of just public health and the public health infrastructure that we have now, and having people think about that and think about how, vaccines have come up now so much more. And as everyone's looking for a COVID vaccine, my hope is that everyone will also rethink about vaccines in general and really how important vaccines are for all children, and that we can think about changing that conversation in many ways for people. So that's another opportunity that's out of all this.
Megan Schutte, thank you so much for being with me.
Thank you.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.